Hello students, welcome to VHSA classes and our today's topic is scope of nursing practice. So in this topic we will discuss that as a nurse how you can perform in a hospital and what are the different kinds of functions and roles as a nurse you can perform. So scope of nursing practice is defined as range of roles, okay? How many roles are there, how many functions are there, how many responsibilities and activities a registered nurse can perform in a hospital setting or anywhere outside the hospital setting. So here we can talk about various roles and human experiences and related to health and illness that a nurse will perform in the society, in the hospital or anywhere in the community. So let's discuss the roles. So nursing practice is accomplished through the following. Okay, there are following other roles also for the nursing practices. So the first role is advocating. So here the nurse will advocate. Okay, as an advocate, you have to advocate for persons' health. You have to advocate for a better healthcare system. You have to advocate for a population health and healthy public policies. Next is utilization of nursing knowledge. Okay, so whatever the nursing knowledge you have to utilize that in the patient care. You have to use your critical thinking. You have to use your judgment, and you have to use your skills while you are providing care to the patient. And the next role here is use of nursing theories and models. So as a nurses, we know that there are so many nursing theories and models, and we have to use those theories, we have to use those model to assess, to diagnose, to make a plan, to implement that plan, and to evaluate the nursing process, whatever we are preparing for the patient. Next is legal parameters. So as a nurses, we know that nurses are bound to the legal parameters. Okay, there are some things those are legally accepted in the nursing profession and some things those are not legally accepted. So your nurse should do the work within their legal responsibilities. Next is holistic approach. As we have already studied that nursing is an holistic process. Okay, it is a whole, it is not a single that you have to provide care to the patient in their physical ailment sector. Okay, we have to provide them care, we have to provide them emotional support, spiritual support. So it is a holistic approach. Okay, and the next thing is active participation of patient. So it is very important whenever we are providing, whenever making a decision for patient or care to the patient. Okay, in that we have to make sure that we are including patient or the family members in that decision making, and we have to also ask the patient to assist in the activities or procedures whatever we are performing on the patient. And the last thing here is collaboration. Okay, so here as we know that the nursing is a part of healthcare team and we have to work with other members also. Okay, and by that we can only provide holistic care to the individual. So these are some practices that we can perform in the nursing profession which will help in provision of care to the patient. So there are different roles of nurses and these roles are broadly classified into two. One is expanded roles and another one is extended roles. So students, what are expanded roles? Okay, expanded roles are within the uh, uh, traditional roles of nursing. Okay, so here in this home care nursing is the one, institutional nursing, school health nursing. See, the area is not the hospital here, but the basic role, that is health assessment, providing care to the patient, health education, that is same. That is the traditional role of a nurse. So that is expanded role. Okay, here the nurse is providing the basic nursing responsibilities to a person, but not only in a hospital setting, but in different settings like home care setting, institutional setting, school health nursing, geriatric nursing, industrial nursing, nurse as a nurse educator, nurse epidemiologist, rehabilitative nurses, and military nursing is also a part of this, disaster nursing is a part of this, and nurse researchers and nurse entrepreneurs are the types of expanded roles of nurses. Okay, nurses can be entrepreneurs, nurses can be researchers, nurses work in disaster areas, nurses work in militaries. So these are the roles. They are not only working in the hospitals, but they are working in different areas, but here they are providing the traditional nursing services. So then comes the extended roles. Okay, so what are extended roles? Basically, extended roles are the roles where nurses are performing more than their traditional duties. Okay, so as you can see here, the first one is certified registered nurse anesthetist. It is not the traditional duty of the nurse, but here they are performing this. They are getting some license, they are getting some additional we can say education, and they can perform these roles. Nurse practitioner, okay, for that they will be getting some additional education, and they can perform the role of nurse practitioner. What is nurse practitioner? Where the nurses can prescribe the medicine for the basic ailments. As we all know that nurses are not allowed to prescribe the medicines right now, but here as a nurse practitioner they can prescribe the basic medicine to the people who are sick. Okay, so the next is psychiatric nurse practitioner. In this, the nurse practitioner will be working in the area of psychiatry. Next is adult health nurse practitioners, pediatric nurse practitioner, nurse midwife practitioner, oncology practitioner, and nurse informatics specialist and registered nurse lawyers. Okay, they will advocate for their patients. So these are some extended roles where the nurses will be performing more than their traditional duties with the additional education. So next in this is factors affecting scope of nursing practice. Okay, so what are the different factors? First one is professional qualification. Whatever your qualification is, your role as a nurse will be as per that. Okay, for example, if the person is having a diploma or a degree, they will be working in the clinical areas. And if a person is having experience of the PhD degrees or some additional degrees, they will be working as an educator. So your professional qualification will be also deciding your roles here. Next is professional experience. Okay, so if you have experience in a particular field, that will also define your role. Okay, for example, if you are working as a counselor, so your education is not enough there. You need experience as a counselor, okay, so that you can provide the services to the people. Next is legal and ethical parameters. So as we know that the nurses, they have to work under the legal and ethical parameters of the nursing profession. So as we were talking about nurse practitioner. So nurse practitioner is a thing that is allowed in USA and some other countries. But here in India, that is not legally permitted. Okay, so that is another thing that they have to work within the legal parameters. Another thing here is professional code of ethics and code of conduct. So every profession is having some guidelines, okay, and we have already discussed that there are some codes of ethics, there are code of conducts that, and then every nurse has to perform according to that. Okay, we have to follow the codes of ethics, we have to follow the codes of conduct, accountability and autonomy. So nursing as a profession, in this there is accountability and autonomy. You have to take the decisions, you have to make the judgments, and you have to be accountable for that. Okay, so nurses should be accountable, they should be able to make decisions on the basis of their judgment within their legal parameters. Okay, and issues and challenges. Obviously, there are so many things, there are so many issues in the nursing. For example, like the infrastructure, where you are working in a disaster area, you're working in a hospital area, illness rate, comorbidities, cost of treatment, availability of resources and manpower, that will be affecting your work. So next is practice trends. So there are so many practice trends such as deinstitutionalization, integrated and community services, holistic aspects of care. So as per that, as per the recent disease conditions, as per the recent notifications, nurses have to perform as per those notifications. And another factor which is affecting the scope of nursing practice is professional practice. Okay, the standards and the quality of care. So there are some standards, there are some quality of care that has been decided by the regulatory bodies, and nurse has to fulfill those. Okay, and personal characteristics of a nurse. Obviously, we are talking about the codes of ethics, we are talking about the legal parameters, but there is another thing, that is the personal characteristics. What are your values, what are your characteristics that will be affecting your nursing practice? Okay, your interest, your altruism, your professional competencies, emotional well-being, your values, and there are some other characteristics also which will be affecting your nursing care. So these were the factors, those were affecting the nursing profession. And after that comes the functions of a nurse. Okay, so as a professional nurse, what are your roles that you will be performing in your area of your care? The first one is leader. Okay, so nurse has to act as a leader, because nurse is a main point of communication between patient and doctors and patients and other healthcare providers. So she has to work as a leader, and so that she can do work for her patient, good work for her patients, and she has to also work as a leader for the fellow nursing professionals also. Okay, next is caregiver, and this is the basic task of a nursing personnel, that they have to provide care to the persons, they have to provide care to the individuals, caregivers. Okay, and another thing, another function of nurse is counselor. So, as we are talking about, nursing is a holistic process. Here we have to provide physical care to the patient, as well as we have to provide them psychological support also. Okay, so here nurse will also act as a counselor for the patient. Next is decision maker. As we all know that the decision making right is with the patient only, but here the nurse will help the patient in decision making. She will assist the patient in decision making, she will assist the healthcare team in the decision making for the treatment. And clinical advocate, nurses act as an advocate for their patient. They support their patient, they try to support the rights of their patient, and they make sure that the rights of the patient are well respected while they are providing treatment to the patient. So nurses will also act as a advocate for their patients. Next is case manager. Okay, so as you know that nurses are the personals who will be contacting with patients on a regular basis and for a longer time period. Okay, so nurses will be a case manager, they will have a role of a case manager. They will be knowing about the case and they have a deep idea of the case, so they can act as a case manager here. Okay, next is comforter. Obviously nurses provide psychological support to the patient, but they have to provide psychological support and comfort to the family members also. Okay, so they will act as a comforter here. Next one is rehabilitation. So nurses not only provide care to the individuals, they will also assist the individuals in their rehabilitation. Okay, they will tell them different kinds of exercises, they will help them to get the vocational services. Okay, they will help them to use various rehabilitation devices and all the other things. So nurses will act as a important part in the rehabilitation process of an patient. Next is communicator. So as we all know that the nurse is a main center point of the communication between different healthcare team members and a patient. So she should be a communicator. Her main function is to communicate the feelings of the patient, the choices of the patient, and she has to communicate whatever the treatment that is planned for the patient by the healthcare team. So she will act as a communicator between healthcare team and the patient. And another thing is teacher. Okay, so many nurses are teachers. Some of them are teacher in the clinical areas where they are teaching their patients about the healthy habits, about the medicines, and some of the nurses are teacher and they are working in the teaching institutions. Okay, they are teaching the future nurses, and so nurses also act as a teacher. They can be a teacher in the hospital setting or they can be a teacher in the institutional setting. Okay, and the next role here is researcher. Nurses are researchers too. Okay, we have to do the researches to find out what are the best practices that we can perform for our patients for their well-being. So these are basic functions of a professional nurse. The first one was leader, caregiver, counselor. She will help in decision making. She will act as a clinical advocate for the patient. Okay, she will be the case manager, provide comfort to the patient, helps in rehabilitation. She will act as a communicator, and she will be a teacher and researcher in the healthcare facility. Okay, so these were the functions of a nurse. Next comes the qualities of a nurse. Okay, what qualities you should have to be a professional nurse? So the first thing is communication skill. as we are talking that nurse is a main point of communication. So she should have a great communication skill so that she can communicate properly with patient and healthcare team members, avoiding any kind of misunderstanding. Okay. And the next quality of nurse is emotional stability. Okay, a nurse should have emotional stability so she can judge the situation as per the situation without being influenced by her own emotions or the emotions of her patients. Okay. Next is empathy. A nurse should be empathetic. Okay, she should understand the patient, she should understand the patient's family, and she has to assist the patient in their care. Okay. Next one is flexibility. Nursing care should be flexible as per the needs of the patient, and nurse should be flexible as per the needs, therapeutic needs of the patient. Next is physical endurance. Okay, so nurses not only provide the communication to the patient or health education to the patient, they provide support to the patient. Nurses assist the patient in their daily activities. Okay, so here they should be physically strong, they should have the strength so that they can assist the patient. So physical endurance here is very important while we are caring for the patient. Another one is problem solving skill. Okay, so here nurses should have a problem solving skill, they should have a critical thinking, they should have a fine judgment so that they can solve a problem immediately and they can help the patient in their problem solving process. Next is quick response. So as we know that nurses are not only working in general wards or the surgical wards, they are also working in the OT, they are also working in the emergency areas, in the disaster areas. So nurses should have a quick response. Okay, they should quickly analyze the situation and they should quickly respond to that situation calmly without being influenced by their emotions at that time. Okay, and the last one is respect and patience. Nurses should respect their healthcare team members and they should respect their patients. Okay, and they should have the patience. So these are some important qualities. There are some other qualities we will discuss further. So next is economic. Okay, so nurses should be economic and they have to choose whatever the perfect economic method of treatment is there. Okay, so economic should be nurses should be economic. Okay, next is sense of responsibility. As we are talking about this, whatever the decision the nurse is taking, whatever the care the nurse is providing, there should be a sense of responsibility and accountability. Okay, nurses should be responsible for the actions they are taking or the decision they are making. Next is honesty and loyalty. A nurse should be honest, a nurse should be loyal to her profession. Okay, you have to tell the patient honestly whatever their situation is. You have to refrain from lying to the patient or to the healthcare team members. And another quality of nurse is discipline and obedience. Okay, a nurse should be disciplined. As you know, there are nurses are working in various shifts and they have to provide care to many personals. So they should be disciplined enough to carry their workload. Next is cooperative and considerate. So nurses as a healthcare team members, they are working with everyone. They are working with family, they are working with patient, they are working with healthcare team member. So they should be cooperative and they should also consider the opinions of other healthcare team members or the family members also. Okay, observant and confident. Nurses should be observant. There are so many things that we have to observe. We have to observe the condition of the patient. We have to observe the environment of the patient. Okay, so this is an important quality of nurse, that she should be very observant so that she can find out a minor change in the patient's health status. And the last one is the knowledgeable. Nurse should have knowledge. She should have the theoretical knowledge as well as she should have the skills that she need for this profession. Okay, so these are some qualities of nurses, that she should be economic, there should be a sense of responsibility, honesty, discipline. Nurses should be cooperative, observant, confident, and knowledgeable. So next is profession and characteristics. So what is a profession? Okay, so profession is an occupation based on the academic study and training to provide skill services with ethical components for a definite fee or salary. Okay, so students' profession is a bit different from occupation. Okay, profession is where there is proper training for that particular profession, there are proper educations for that particular profession, and there is a proper we can say curriculum for that profession that you have to fulfill. That is a profession. Okay, whereas in occupation you don't need to have a degree, you don't need to have an educational status. Okay, so that is the difference between a profession and occupation. So a profession requires a extensive education, it requires knowledge, it requires skills, it requires preparation. Okay, so nursing is a profession because there is a sound curriculum, there is a sound requirement of skills, so it is a profession. So profession is defined as a job and a practice which requires mastery of a complex set of knowledge and a specific skills through formal education and practical experience. So nursing is fulfilling all these requirements to be a profession. So what are the characteristics of a profession? So let's discuss one by one. First one is well-defined body of knowledge. Yes, nursing is having a well-defined body of knowledge, and there is a curriculum given by INC, okay, which properly define that for the B.Sc Nursing that you have to complete in 4 years, and this would be your syllabus. In GNM, you have to complete it in 3 years, and this will be your syllabus. Okay, so there are different curriculums, proper guidelines for different courses in nursing. Next is strong service orientation and provide specific services. Okay, so nursing is a service oriented profession. Okay, we provide care to the people, individual, family, community. So it is a service oriented profession, and there are specific services. There are child health nurses, there are adult health nurses, there are psychiatric nurses. So there are specific services also, even though there is home care nursing also. Okay, next one is standardized formal education. Nursing is having standardized formal education. There is B.Sc Nursing, MSc Nursing, and other courses also, and those are standardized. Okay, there is proper hour division, there is proper year and semester division for that, proper examination format is there, and you have to fulfill the practical hours. So it is having a standard formal education that you have to complete before being a nurse. Practice is based on professional standards and codes of ethics. So yes, there are professional standards in nursing, and there are codes of ethics in nursing too. Okay, and we also follow those. For example, the autonomy, we have to care for the patient, and we have to be free from judgment. So there are so many things here, and there are professional codes of ethics in nursing. Members of the profession should have autonomy in decision making and practice. So yes, nurses have the autonomy in decision making. They are accountable for their decision making, and they are responsible for their decision making. Whatever the care they are providing to the patient, they have to be accountable for that. And the next one is profession is practiced in a specialized setting. Yes, nursing is also practiced in a specialized setting. Okay, and the settings vary. Like first one is the normal setting, that is the hospital setting or the clinic settings. Okay, other than that, there are other settings too. For example, there are mobile clinics, there is community settings, CHCs, PHCs, but there is a specialized setting. Okay, and you can perform this profession in there only. So these are some of the characteristics of the profession, and nursing is fulfilling all these characteristics. Okay, so what is nursing as a profession? So as per the changing needs of a society, there is change in the nursing also. Okay, and modern nursing is art as well as science. It is focusing on individual, it is focusing on community, it is also focusing on the family. It is not only focusing on a person who is sick. Okay, so there is a criteria for a nursing profession. So let's discuss this. The criteria for a nursing profession. The first one is body of knowledge. Okay, yes, nursing is having a body of knowledge. There is a proper curriculum given by the INC, Indian Nursing Council, and it is having a body of knowledge. Specialized education. As I told you, there is specialized education. Okay, there are different courses, and there is specialized education also. There is subspecialty in Masters of Nursing also. Service to the society. And as we all know, nursing is a noble profession. We serve the society. We provide service to the society for their well-being, okay, for their health. Accountability. Whatever we perform, whatever we provide services to the patient, we are accountable for that. We are responsible for that. Autonomy and independence. Yes, nursing is a autonomic or independent profession. Okay, we have our own regulatory body. We have different regulatory bodies. We have INC, we have state regulatory bodies. So we are independent as a profession. Okay, we make our own decisions, we make our own curriculum. So we are autonomic in our profession. Next is code of ethics. Every profession is having codes of ethics, and nursing is also having codes of ethics. Okay, there are different codes of ethics. Some of them are given by ICN, some of them are given by INC. Okay, and there are ethical principles too that we have to follow within the nursing profession. And another thing here is professional license. Okay, so all the nurses who are working in hospitals or in nursing homes or in community setting, they all have the license. Okay, and you can attain this license after the completion of a proper standardized course. Even after GNM, after BSc, after masters, after post basic, but you have to complete that to get that license, and you have to fulfill the standardized criteria for that. Representative organization. So in nursing, there is also representative organization. There is INC, there is TNAI, there are state regulatory bodies which are representing the nursing on a global level. And evidence-based nursing practice. Research is very important part of nursing, and nursing is also following the evidence-based practice. Okay, we are taking the evidence and finding the best solution for the patient, and we are providing the best care for the patient by following the evidence-based nursing practice. So nursing as a profession, as I told you, body of knowledge, there should be a body of knowledge, and nursing is having a body of knowledge, okay, so that we can make proper judgment at the time when we need to provide care to the patient. Specialized education, yes, there are specialized programs, there are specialized courses, and we provide education in those courses. Service to society. Yes, nurses provide service to the society. Accountability, nurses are accountable for whatever they are performing, whatever the task they are doing, whatever the judgment she is making, okay, and she have to make sure she is upholding the quality of nursing care. Autonomy and independence. As I told you, nursing is autonomic in nature. It has its independence, okay, and nurses can use their critical thinking, and they can find out the best solution for their patient, and that they can do it with their independent nature. Codes of ethics. Nurses are following the codes of ethics given by the Indian Nursing Council or by the International Nursing Council. Professional license, and as you know that nurses work after they are getting the professional license from their state bodies or the INC, okay. Representative organizations, there is TNAI and State Nurses Registration Councils, which are the representative organizations of nurses. They work for the development of nursing profession, for the betterment of nursing profession and the professionals. Okay, and evidence-based practice, as I told you, that nurses gather the evidences, they gather the data, and they find out what is the best solution for their patient, and they will choose that best solution for the care of their patient. So this is all about the scope of nursing and nursing as a profession. So nursing as a profession, it includes three things. One is cognitive, another one is psychomotor activity, and one is affective. Cognitive means you have to use your brains. Psychomotor activities, you have to use your skills. And affective, that means you have to use your emotions, and you have to be empathetic here while you are dealing with the patients. So these are the three main components of a nursing profession. Okay, you have to use cognitive abilities, you have to use your skills, and you should be affective in nature. Okay, so thank you so much, students. This was in the scope of nursing.